Hello and welcome. If you're getting ready for the NCLEX, you already know that maternity questions are all about safety and thinking on your feet. So today, we're going to do a super high-yield review of the major risk conditions that you absolutely have to know for the exam. We're going to break them down with some simple memory tricks so you can walk into that test feeling totally confident. Let's get right into it.
And I have to give a quick but really important shout out to Dr. Abdulkareem. He's the one who provided all this fantastic source material for this session. You know, it's this kind of expert level info that we're going to boil down into exactly what you need for the NCLEX. So a huge thank you, Doctor.
Okay, picture this on your exam. A pregnant patient comes in with bleeding. The question is going to test you on what's happening, and this is such a classic NCLEX setup. Knowing the difference here, well, it isn't just about passing a test. It's about knowing what to do to save a life. So let's make sure you know this cold.
So here's our game plan for today. First, we're going to decode those bleeding disorders. Then, we'll jump into hypertension and preeclampsia. After that, we'll tackle diabetes during pregnancy and then navigate the torch infections. And you'll definitely want to stick around to the end because I'm going to leave you with one final tip that might just change how you look at every single question on the NCLEX.
Let's kick things off with our first topic, and trust me, it's a big one. This is one of the most commonly confused conditions on the entire exam. Placenta previa versus abruptio placentae. Our goal here is to make this super simple and totally unforgettable.
So look at how clear this distinction is when you see it side by side. For previa, just think P for painless. The blood is bright red and the uterus feels soft. But for abruptio, it's the complete opposite. We're talking agonizing pain, dark red blood, and a rigid, almost board-like uterus. These three signs right here, that's your ticket to getting the right answer every time.
And this right here just drives the point home. This quote is basically straight from the NCLEX Bible. If you can, commit this exact sentence to memory. Painless previa, painful abruptio. That is the whole ballgame.
All right, let's move on to our second major topic, hypertensive disorders. Preeclampsia is a huge player on the NCLEX. The key isn't just knowing what it is, it's being able to spot those subtle signs that tell you your patient is getting worse.
So what is this thing really? Well, preeclampsia is basically high blood pressure that shows up after 20 weeks of pregnancy. And here's the crucial part. It can mess with organs all over the body. And if you don't catch it, it can turn into eclampsia, and that means seizures, a true medical emergency.
So whenever you see a question about a patient with preeclampsia, your little nurse antenna should go way up. You need to be scanning that question for these warning signs. A headache that just won't quit, blurred vision, maybe some pain in their upper stomach. These aren't just symptoms, they're giant flashing red alarm bells that things are escalating.
Okay, let's put you in the hot seat. Those alarms we just talked about have gone off, and now your patient is having an eclamptic seizure. The computer screen flashes with a priority question. What are you going to do first?
Here are your steps, and the order is everything. Number 1, you never ever leave the patient. You stay right there and you call for help. Your absolute top priority is their safety and their airway. Get them on their side to keep them from aspirating. Then you get oxygen on them. Notice how giving meds comes after all of those immediate safety steps? That sequence is so vital for the NCLEX.
And you've got to be on the lookout for this really severe complication, HLLP syndrome. Oh, the NCLEX loves to test this. You have to remember what each letter stands for. Hemolysis, that's the breakdown of red blood cells, elevated liver enzymes, and low platelets. If you see these labs on a preeclamptic patient, you know you're dealing with a 5-alarm fire of a medical emergency.
Okay, let's totally switch gears now and talk about our third topic, gestational diabetes. It's not just about high blood sugar. The real thing the NCLEX wants you to know is the wild ride that insulin needs take throughout the pregnancy. It's a pattern, and they love to test it.
And this slide just lays out that pattern perfectly. In the first trimester, and this is the tricky part, insulin needs actually go down, which puts mom at risk for hypoglycemia. But then, bam, second and third trimesters hit, and those placental hormones create insulin resistance, so their needs shoot way up. And then, as soon as the baby's born, that placenta is gone, and insulin needs just plummet. You have to know this up, down, down pattern.
All right, let's move on to perinatal infections. Now, there are a lot of them to remember, but lucky for us, we have one of the absolute best mnemonics in all of nursing to help us out. Torch.
So what is this torch thing? Well, it's basically a group of infections that are famous, or maybe I should say infamous, because they can pass from the mother to the fetus right across the placenta, and that can cause some really devastating birth defects.
Let's break it down really quick. T is for toxoplasmosis. When you see this, think raw meat and cat litter.
O is for other, which includes things like hepatitis B. R is for rubella, which is super dangerous and can cause major birth defects, especially in that first trimester. C is cytomegalovirus, and H is for herpes simplex virus, which might mean a C-section if there are active lesions. Just knowing what TORCH stands for can help you answer a bunch of different questions.
So we've covered bleeding, preeclampsia, diabetes, and infections. That's a lot. But just knowing the facts is only half the battle on the NCLEX. The real test is, can you apply them? So let's put it all together with a quick practice question.
Ah, yes, everyone's favorite, the select all that apply question. Don't panic, just take a deep breath and think back to what we just talked about. Which of these things are known risk factors for developing preeclampsia?
And there you have it, the answers. Do you notice a theme here? It's all about things that put extra stress on the body's vascular system. A first pregnancy, having a history of it, carrying twins or more, chronic high blood pressure. All of these are major risk factors. Knowing this stuff helps you spot those at-risk patients early on.
Okay, let's lock all this in with a lightning round review. Ready? For bleeding, your hint is painless previa, painful abruptio. For diabetes, you got to remember that decrease then increase insulin roller coaster. For preeclampsia, your biggest red flags are headache and vision changes. That means it's getting worse. And for infections, it's all about TORCH. This is your super high yield summary slide right here.
But you know, I want to leave you with more than just a bunch of facts. The NCLEX is really a test of your judgment. So whether you get a super complex scenario or a simple priority question, there is one question you have to ask yourself before you even look at the answers. What do you think it is?
This, right here. What is the most immediate risk to my patient's safety? Not what's interesting, not what you might do later, but what is the most urgent threat happening right now? Think airway, breathing, circulation, bleeding. If you can answer this one question first, you will find the right answer on the NCLEX, and more importantly, you'll find it in your practice as a nurse. Good luck.